How does autoimmune conditions show up on our nervous system scans? We have a patient here who's been dealing with a autoimmune condition, which is essentially a demyelination condition, very similar to the term we would use as MS or multiple sclerosis. But what it basically does is autoimmune is where your body's starting to attack yourself. And there's so many different types of these conditions. But the one thing I love about these scans, it actually kind of shows us how it's affecting the body. Now, we've seen these thermal scans before, and if you remember, the baseline is we're taking a temperature reading here at the sacrum. And what we want to do is we want to see red bars gradually getting bigger following up through here. One thing we want to minimize is the amount of blue bars. And what's very interesting in this case is that there is all blue bars and it's bilateral, so both sides. So essentially, her body in this situation is attacking itself and it's shutting it down into a stage of what we like to see of kind of a chronic fatigue, where the nervous system is no longer trying to fight, it's no longer trying to overfire, it's just basically keeping its head above water. And when we address these conditions, you can't go in there and completely overstimulate them, because if you try to overstimulate the nervous system, the immune system, the digestive system, the body will start to increase inflammation and start to increase attacking on itself. So in a case like an autoimmune condition where we're seeing bilateral blue bars throughout the entire spine, less is more. We gradually go in and we adjust 1, 2, maybe 3 segments at a time. We decrease their treatment frequency to once to twice a week, and we monitor their situation on how they're feeling very, very closely. But it's just so interesting when we take a look at these scans. So many times we talk about the body's been overworked, so much inflammation that we need to calm it down. Here we need to very slowly stimulate it and turn it back on in a controlled fashion. But in the one area that's kind of overfiring on this scan, where we start to see these blue and green bars here, this is right where the adrenal glands are firing. So this is also showing a tremendous amount of stress that our body's firing in that fight or flight, that keeping the head above water solely. That's its job, is looking at today and tomorrow. It's not looking ahead long term. When we look at her surface EMG scan, we actually see it's a fairly decent symmetry score of a 76% starting. But what we're seeing is kind of this huge spasms here, huge spasm here, where we're kind of getting that counter rotation stress. What we will tend to see is a lot of tension throughout the mid-back, decreased flexibility, not able to do a lot of exercise because of that chronic tightness. So if you feel that you know someone that is dealing with autoimmune, if you're dealing with autoimmune conditions and you want to see if chiropractic may be able to kind of help in that situation, like we always say, get scanned. So call us today, send us a message for an appointment, send in your friends and loved ones. Hope this helps.